The Petrocelli Surgical Pavilion is really the culmination of years of planning and an evolution of this campus, which really started as a community hospital in the 1950s, an organization that has seen a tremendous evolution not only in its clinical capacity, but also its identity. And a big focus of that identity is around having a facility set that really matches the caliber of the care that's provided here.
This was all farming community, and the hospital initially was created because there was a kid killed nearby on what is now Community Drive. And there was no place to take that kid quickly, and so a lot of the local leadership in the region decided that it was important to have a facility here.
It's grown not only in size but in complexity. As we've been able to add different clinical services, we've had to attract different talent, we've had to provide different equipment, we've had to provide different facilities. This transforms an institution.
Back in the 90s, the leadership there decided that creating a health system was something that should be done in New York, and that it was probably not achievable, but North Shore did it.
The Sandra Alice Bass Heart Hospital was another major transition that really focused on taking the best of the clinical programs in heart that we had and sort of reorganizing that care to create a major destination program on this campus.
One of the milestones that is very vivid is the effort to become a transplant place, at a time when most people thought that that was an impossibility.
What we've seen is an evolution of the ability to take care of the region's most complex cases. And that's most evidenced by this medical center being the only hospital in Nassau, Suffolk, and Queens that does liver, heart, and lung transplantation.
And as the complexity grows, the ability to provide more advanced care grows. Our ability to serve not only now Nassau County, but the region and America itself.
It's having a winning attitude, and that permeates right through all of the leadership at North Shore University Hospital so that they can go higher and higher than people ever thought that they could.
The new surgical pavilion represents the largest expansion at North Shore University Hospital in over 30 years. When I look at this building, I look at the future for North Shore and for Northwell.
With the new addition and the support of the Petrocelli family, we now will be able to take care to a completely different level.
We're very proud the way in which the community has stood up and supported the construction of this building, but also the way in which many community members have contributed financially. And I think the decision to build a new building and 100% invest in that building in two things: perioperative areas, specifically operating rooms, and critical care beds, is a reflection of the fact that that is the identity of this institution.
It's a limitless environment to be creative and innovative, consistent with the original DNA of North Shore Hospital itself.
It validates for the thousands of people that work here that we are on the move, and that this will certainly not be the last major project that gets built on the Community Drive campus, and it sets us in motion on a much longer-term master plan that we have to continue to see this campus evolve as a major academic, research, and teaching campus.